like to thank everybody for coming out tonight. If we wait another 45 minutes, it's going to go from 97 down to 95, but I think we'll just get started. So I'm Mayor Leahy. I'm here along with my colleagues. I'll introduce them in a minute. But we're here today to remember those we lost over the past year and a half with COVID. So I appreciate everybody coming out in the warm weather for such a nice memorial service. So I'd like to introduce my elected officials, my colleagues that are here with me. Councilor Noon, Councilor Drinkwater, Councilor former Mayor Rodney Elliott, Representative Vanna Howard, Representative Sakari Chow, Councilor Dave Conway, Vice Mayor Rita Murcia, and Councilor Dan Rourke. So thank you everyone for coming out today. This is put on by myself and the entire City Council, the administration team. So again, thank you for coming out tonight. We have a full program, and I'll introduce City Manager Eileen Donahue, and we'll get right to it. We won't keep you out here too long in the heat, but it is an important night, and thank you again for everybody coming out. City Manager.
Thank you, Mayor Leahy, and good evening. Thank you. Oh, and Councilor William Samaras is also joining us. Thank you for joining us tonight on this solemn event as we remember the lives that we've lost to COVID-19 and the crisis, and we reflect on that difficult period our community has gone through. It's hard to believe it was more than 15 months ago that seemingly overnight our worlds changed as COVID-19 reached the United States. On March 15th, 2020, we learned of the first positive COVID-19 case here in the city of Lowell. Just days earlier, a state of emergency was declared in Massachusetts, and we entered a period of lockdown with no certain date to end. None of us could see what the future would look like, but we knew that entering an unprecedented period in history in our community and our nation, we were all feeling a profound sense of anxiety, and we encountered the unknown. While we would eventually adapt to new ways of life, to FaceTiming our relatives instead of getting together in person, to Zoom celebrations or meetings, remote learning, we were continuously met by apprehension. And as more and more members of our community got sick, there are 319 flags planted in the lawn tonight. Each one of them represents the life of a Lowellian that was lost as a result of this devastating pandemic. Collectively, they represent a significant loss to our community, and individually, they represent an unimaginable loss to their families and those who cared about them. Most tragic of all, the loved ones of those who passed away during this pandemic often never had a chance to say goodbye. In many cases, too, there was not an appropriate opportunity to honor the lives of those given the limitations on gatherings in places during the pandemic. Through this evening's event, we are coming together as a community to offer the tribute and remembrance to those that lost their lives to COVID-19, what they so truly deserve. And on behalf of the City of Lowell, we offer our heartfelt sympathy and condolences to the families of the COVID-19 victims. And while we're all pleased that life is beginning to return to normal, thanks to the significant decrease in COVID transmissions enabled by the vaccine, we must never forget the tragedy that this virus inflicted on our community. In closing, I want to, first of all, thank all of the frontline workers who sacrificed their own health and safety throughout the height of the pandemic to minimize its toll on our community and to prevent further tragedy. And I know the mayor will recognize, but I do want to give special thanks to our partners in this community, to Lowell General Hospital for all they did. Joining us tonight, we have Jody White, the president of Lowell General, and Amy Hoey, who has done so much for us. Thank you both for all that you did. I also want to give special thanks to Lowell Community Health Center and Sue Levine and her team. They were amazing. And they never stopped. They never said no, and they were there every step of the way, helping and protecting our community. And so when we think of the frontline workers, the health workers, police, fire, you name it, grocery store workers, we asked so many people to stay home and stay safe, but so many others we asked, continue to report to work, continue to do your work, whether it was in emergency rooms, in the grocery stores, or on our streets. We also owe you each a tremendous debt of gratitude. Thank you very much.
Thank you, City Manager. Next, we have Dr. Kumble, physician over at Lowell Community Health Center.
Thank you very much. We all know why we're gathered here today. Primarily, I'm here to tell you a couple of stories that has impacted me personally, as well as the work that we do at Lowell Community Health Center. So it was early May when we had reverted back to telemedicine, mostly calling patients just to check in. And I scanned my schedule, and then I called this patient of mine that I've known for 16 years. Hey, Jose, how are you doing? Doc, I'm glad you called me today. His voice didn't sound any different. I've known that voice for 16 years. I held him as a baby at the hospital when he was born to two beaming Guatemalan immigrants who had arrived maybe a year or two ago, and were so proud and so happy to have this baby with them and wanted me to make sure the baby was okay. Since then, I've seen him many, many times. The minute I asked him how he was doing, I almost regretted it. He said, Doc, I lost my dad about a week ago to COVID. My grandfather is ill, very ill with COVID and in the hospital right now. I don't think he's gonna make it. My mom's doing okay, and my sister has no symptoms, and we are all in isolation and quarantine. This was in May. I did not know how to respond. Years of training in medical school and talking to people who go through tragedy is seemingly what we do. But suddenly, when we're faced with something unknown, something tragic that happens in our lives, it's very difficult to react. We got to talking about a lot of things. We were able to connect him with a lot of community resources at that time, thanks to the community health workers and the team that we have at Lowell Community Health Center. We were able to help him through what seemingly was a terrible crisis with his family. We were able to connect him with social workers and mental health workers as well, to be able to try and connect and cope with the tragic loss that he has had. We are here today to remember many people like this. Every one of you has been touched in some way with this terrible virus and terrible tragedy that we have gone through this past year. And many probably continue to feel the impact of this all through the time that we have spent. Today, we gather to reflect on a time that was sad, a time that was painful, a time that was scary. We must acknowledge that and grieve for what was lost. Today we gather to recommit to assuring that everyone in the community is heard, everyone is reached, and feels the healing power of love they so deserve. In that regard, we have a lot of work to do ahead, and we are all in this together. And today we gather to look to the future with hope. No one said it better than our youth poet laureate, Amanda Gorman, that even as we grieved, we grew, that even as we hurt, we hoped, and even as we tired, we tried. And personally, I lost my father this April in India. I could not travel to be there with him to hold his hand to say goodbye the way I wanted to. But the most remarkable thing was the community around me, my coworkers, my family, all the people around me held my hand, walked with me, wiped away my tears, and really comforted me in the time that I needed most. This really set the stage for me to understand the pain that other people are feeling today. If there's one thing I want to leave you with today is that reach out to somebody, reach out and hold their hand as we're able to, as we celebrate coming out of this pandemic to some extent. Hold somebody's hand and reassure them, just to hear them say, I'm glad you called today. Thank you very much.
Thank you very much, Doctor. That, just shows us that we are a community and we need to reach out to each other. Next, we have Sarah Kung Lang from the Deputy Director of the Office of Congresswoman Lori Trahan.
Thank you for inviting me to speak today. I'm going to start off my remarks with 2 dates. Sunday, May 17th, 3:30 p.m. Monday, May 18th, 1:10 p.m. These are the dates and times that will forever leave our hearts shattered. I never thought that I would be standing here before all of you, speaking in loving memory of not just one parent, but both of my beloved parents on this very hot summer day. I'm one of the families who lost a loved one to the virus. I don't want my parents' death to be just a number amongst the 602,000 victims in the United States, and also the 319 Lowell residents who are gone. I'm here this evening to honor their memories, to make sure that people knew who they were, how much their lives impact so many in their community. My parents, Hang Por, Sam Nang Lorne, also known as Chun Lee, they were married for 46 years until that day in May that changed everything. My dad passed away on Sunday, May 17th, and in less than 24 hours, my mom passed away on Monday, May 18th. They passed away peacefully due to complications of COVID-19 at Lowell General Hospital. Although I couldn't be there by their side when they took their last breath, I take solace in knowing that caring nurses and the doctors at Lowell General Hospital were there with them until the very end. My parents were born in Battambang, Cambodia, lived through and survived the killing field, lost a 2-year-old daughter during that time, traveled hundreds of miles on foot to reach the refugee camp at the border of Thailand. We eventually immigrated to Chicago in 1981 and moved to Lowell in 1987. My dad was the oldest of 4 and my mom was the youngest of 4. They were very proud parents of 3 children. I'm the oldest of the 3. My youngest brother, Sari, lost his battle to cancer 2 years ago on May 4th, 2019, at the age of 38. My parents had very different personalities. My dad was very reserved, soft-spoken, known for his big smile, calmness, and laid-back demeanor. He's the one you went to if you wanted to get something done and done right. He only wanted to help others and never needed the recognition. He was the one behind the scenes, the get-it-done kind of person. If you visited the Buddhist Glory Temple, you might have met him. He's the one that's always there setting up events and helping families. My mom, on the other hand, very outspoken. You know the saying, the wife is the boss? Well, she was the boss. Everywhere she went, people loved her, and she loved to feel needed. She was the type of person that would give you the shirt off her back. She loved to cook, loved to see people enjoying her Cambodian cuisine. My parents loved their family and friends. They were generous, kind, and always willing to help people in need, which was a testament of their strong belief in Buddhism. They were religious, charitable, they believed in merit, and they believed in giving back to the community. They always found ways to support their homeland, Cambodia. They donated their life savings to build temples, water wells, elementary schools, raise donations for rural provinces in need. It was clear how much they were loved and respected by the amount of people who came out during the peak of pandemic to participate in the procession to the crematory in Haverhill. Someone told me it was close to 100 cars that came out that day. This past year has been extremely difficult and painful for our family. On this evening, I know they are beaming with joy and full of love from heaven, knowing that they are not forgotten. I will live forever with this great heartache that I never got to say goodbye and hold their hands as they took their last breath. And most of all, thank them for their unconditional love and the sacrifices they made for us. Even though they are not here physically, their memory lives on in our heart and the hearts of all that knew them. My heart will never be whole again, but I wanted to express my deepest heartfelt gratitude and appreciation to all my family, especially my second family, my coworkers, and of course, my most caring and loving boss, the Congresswoman Lori Trahan, and to all of our friends who continue to keep our family in your prayers, and those who continue to reach out to us. Thank you to the city for holding this vigil for all those who have lost ones, and to the families who lost a loved one. As the days continue to pass, I hope you find comfort and support in the people that surround you and the wonderful memories you carry in your mind and in your heart. To everyone here, please live as if tomorrow is not promised. I want to end my remarks with a quote from Buddha. In the end, only three things matter: how much you loved, how gently you lived, and how gracefully you let go of the things not meant for you. Thank you so much, everyone, for letting me share my story.
Thank you, Sarah. Next, we have Eugene Stolkin from Campus Ministry at UMass Lowell to come up and say a few words and prayer for us. Thank you.
The title of this evening's event is Community Vigil, to honor lives lost to COVID-19. A vigil may be defined as wakefulness maintained for any reason during the normal hours for sleeping, or a vigil may be a watch or a period of watchful attention maintained at night or at other times. This evening we have gathered for a period of watchful attention. Watchful attention as we remember the 319 people in the community who died from COVID-19. Watchful attention to the feelings that may be surfacing. Feelings perhaps of grief and sorrow, of nagging loss, of numbness, of disbelief, or perhaps even of relief. Watchful attention to those gathered around us who may be in different stages of grief. Some of those we commemorate this evening died early in the pandemic before we even really knew what was happening. We have already felt deeply their absence at a birthday celebration or a special holiday observance. Others have died more recently, such that the wound is still open and raw and very tender. As has been noted already by previous speakers, some died alone without the benefit of family and friends gathered around. Others were able to have loved ones present. In any case, I lift up for you the word gentle. When the anniversary of your family member's death comes around and your world seems a bit off kilter, be gentle with yourself and those around you. Be compassionate to yourself as well as to others. When the birthday or wedding anniversary of your friend's or family member's death comes around and something seems off balance, be gentle with yourself. Treat yourself kindly. When you think you've gotten used to your loved one's absence, but something, a fragrance, a piece of fruit, a song, reminds you of that person and you are overwhelmed without warning with a feeling of loss, take a deep breath and be gentle with yourself. When the loss of your loved one brings to mind other losses, even seemingly unrelated ones, such as a job loss, be gentle with yourself. Even as we continue to mourn, let us celebrate the lives of those whom we commemorate. What were the blessings that each person brought? What was a particular gift each shared? We become the vessels through which their spirit lives. We honor and perpetuate their memory by living our lives according to the values upon which they based theirs. I invite you now to join me in a brief blessing. Blessed be the memory of each of the 319 for whom a flag has been planted this night. We give thanks that they were given to us to know and to love as our companions on earth. May we find specific ways to honor their lives through our actions in the world. Blessed be those who grieve, who are worn down with sleepless nights, whose world just doesn't make sense anymore. May they find joy in remembering their loved one, and may they find solace and be comforted. Blessed be those who have found a way to embrace life again. May they not feel guilty that they have survived, but may they use the wisdom gained from living through their pain to reach out to others who are suffering. Blessed be the first responders, the healthcare professionals, the essential workers who cared for our loved ones in their last days and hours. May they find encouragement to carry on when discouraged, and may they find rest when exhausted. And blessed be the friends who accompany us in our sorrow, who offer casseroles and handkerchiefs, and who remember the anniversary of loss with a card, call, text, or email, who don't hesitate to check in with us and ask how we're doing. May they not grow weary of hearing us speak of our loved one, so that, though weeping may linger for the night, joy may come with the morning. And may the light disperse the shadows, and healing dispel the pain. May we move from despair to hope, from fear to trust. May the love of family comfort us, the support of friends sustain us. May we be led from death to life, and may peace fill our hearts, our homes, this earth. And may it be so. We come now to a moment of silence. A word about the silence. If we were to pause even 1 second for each of the 319 people whom we are remembering this evening, it would take us over 5.5 minutes of silence to do so. This demonstrates in a tiny way, as has been indicated earlier, the magnitude of the hole left by the death of these 319, not only for individuals personally, but for this community. So I invite us now to a brief period of silence, at the end of which I will ring a small bell. Let us be in silence together. Thank you.
Next, I'd like to invite Joanne Keegan to come up. She's done a heck of a job this year, as many people have, but special recognition to you, Joanne, for all the stepping up and doing, you know, much more than we ever could expect from you. So we appreciate everything you've done. So I have a citation. Be it hereby known to all, the City of Lowell, Commonwealth of Massachusetts, hereby commends and appreciates Joanne Keegan. At the start of the coronavirus pandemic, Joanne was already going above and beyond the call of duty, having come out of retirement to assist as interim health director for the city. As the crisis expanded, Joanne was chosen by the city manager as the one to lead Lowell's pandemic relief efforts as COVID-19 incident commander. This included, among many other responsibilities, the vital task of coordinating the city's vaccine distribution. Joanne organized and expert response led from the front and was a constant present at the city's vaccination site at the Lowell Senior Center in planning sessions with other health officials in the city. She provided the experienced leadership in public health discussions and quickly earned the respect of all of those who worked alongside her. Now, therefore, I, Mayor John Leahy, hereby offer my sincerest thanks to Joanne. The entire city of Lowell commends her for her tireless work and her service to the city, saving countless lives in the process. We owe her a heartfelt gratitude and recognize her for a job well done, given this 29th day of June 2021 by myself and the entire City Council. Thank you, Joanne.
Thank you very much.
Thank you, Mayor Leahy. I will miss your just checking in phone calls, which were very supportive during my time here with the city. In the world of public health, even one death from a preventable communicable disease is considered a sentinel health event. For me, it was so much more than that as the interim health director, as a nurse and a member of this community, to watch people dying from a preventable disease. It felt like the public health system that I spent my life working in was failing. It's important tonight to acknowledge those deaths and to learn from them. All of the people currently hospitalized in the United States with COVID have one thing in common. They're all unvaccinated. And they're currently younger than those folks that were hospitalized at the peak of the pandemic. So let's honor those that died tonight by convincing our vaccine-hesitant friends and family to get vaccinated. I can't think of a better way to honor them. In closing, I would like to thank Manager Donahue, whose incredible, calm support throughout the pandemic was very helpful to me in my role, and to her staff, who were also very helpful. And also a shout out to the health department nurses, my partner Nicole Chauncey, who was a tireless, caring nurse who was incredible during the pandemic. It was an honor and a pleasure to work with all of you, and I thank you. And I also truly appreciated the partnership with the hospital and the community health center, because we couldn't have done it alone. Thank you.
And lastly, we're going to have a musical tribute, Amazing Grace, performed by Tanisha Scarlett.
Sing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see. Through many dangerous toils and snares, I have already come. Was grace that brought me safe thus far, and grace will lead me home. Amazing grace, how sweet the sound that saved a wretch like me. Was grace that brought me safe thus far, and grace will lead me home.
Thank you, Tanisha. I'd like to thank everybody for coming out again tonight. Great to hear all the speakers share their stories. And again, let's take a moment to remember the ones that we lost, not just from Lowell, but everybody that we may know and friends of ours, family members. So thank you for coming out. Appreciate it. And God bless. Thank you.